Hello, everyone, wherever you are in this little world. I'm Alex Pashov from Crystal Touch Bell's Palsy Clinic, and today we'll speak about Ramsay-Hunt syndrome. What is Ramsay-Hunt syndrome and how it is different from Bell's palsy, if it is different? First, let's discuss what causes Ramsay-Hunt syndrome and what it is. Actually, the Ramsay-Hunt, what is called Ramsay-Hunt syndrome, it is a peripheral facial paralysis. Generic name of this functional disorder is peripheral facial paralysis that has been caused by herpes virus. So when the cause of the facial palsy has been established and it is evident that it is due to herpes virus, then it gets the name Ramsay-Hunt syndrome. What is herpes virus? Sometimes in the folks' mouth is called shingles or cold sores. It is not necessarily that you should have had cold sores on your lips or any other place of your body to have it cause your Ramsay-Hunt syndrome. It is not necessarily. Sometimes bacteria and viruses and other pathogenic organisms just live in our body, but they remain in check by our immune system, and only when we are, due to certain reasons, our resistance is reduced due to stress, physical exhaustion, cold, and so on, then those, in our case, herpes virus has the chance to expand, to flourish, and to cause extensive inflammation in some particular areas. And in our case, it is mostly in the pyramid of the temporal bone, where the facial nerve is running along a bony channel, which is 33 millimeters long, the longest bony channel in our body, and where, of course, it is very fragile, very susceptible to any external influences, and in which case, herpetic eruption or herpetic inflammation is quite a heavy and challenging thing for such a delicate part of our body as the facial nerve. Normally speaking, the herpes virus lives or resides in the dormant state, like sleeping, in our nerve tissue. It just can stay there forever without showing itself being present. But if the resistance of the body is reduced to whatever reasons, as I said already, it could be stress, it could be physical exhaustion, it could be cold, extensive influence of cold, it could be in some cases high blood pressure, it could be some cases high sugar levels. In some cases, could be also women when they're last weeks of pregnancy, could be a contributing factor. Then the virus has a chance to wake up and to start its activities and cause inflammation by traveling along the nerve tissue. In our case, it could be living, let's say, inside the nerve, facial nerve, for example, and then it wakes up, it travels up, retrograde travel it's called, and whenever it achieves or reaches certain favorable place to stop and start blooming, it stops there, and usually it is the pyramid of the temporal bone where, as I said, our facial nerve is rather vulnerable and susceptible to injury due to swelling. Those of you who have ever experienced cold sores on the lips, for example, know that this is quite a nasty symptoms. It starts itching, it starts having unpleasant feeling, it swells, it gets pinky, red, and it does not go away quickly. And that is namely the difficult part of the Ramsay-Hunt syndrome, which is caused by herpes virus. It does not go away quickly. That is why when it has been established that you have a Ramsay-Hunt syndrome, very, very important. Start with active doses of antiviral medications. Not only prednisone, which is usually being prescribed for any case of facial palsy, including Bell's palsy, which is idiopathic facial palsy, which means the cause could not be established, but also for Ramsay-Hunt syndrome. Whenever it is there, it is very, very advisable to start with serious doses of medication. Of course, don't do it on your own. Consult your medical practitioner, your physician, your neurologist, or your ENT doctor. But if it is certain that you have Ramsay Hunt, antiviral medications increase your chances for better and sooner recovery. Another accompanying symptom very often that accompanies the Ramsay Hunt syndrome is a severe pain. It is not that Ramsay Hunt cannot happen without pain, but in most cases, pain does appear as one of the serious symptoms, and sometimes it's such a heavy, excruciating pain that even loads of gabapentin or other painkillers cannot cope with it. And if the pain is present, then it is not a very good prognostic sign, because it means that the inflammation is very heavy, very serious, and the virus has achieved its very high level of activity. And of course, to get rid of that thing out of the inflamed area will take time. It takes maybe a week, maybe 10 days, maybe in some cases even longer than that. And only after the damaging factor, and in our case it's herpetic infection, has been removed active, only after that the recovery starts taking place. Why? Because when there is an infection, when there is an active inflammation, the tissue around here becomes swollen. And when it's swollen, it compresses the facial nerve. And when it's compressed, the nerve cannot function. So the first things to get damaged gets the myelin sheath, which is electrical insulation of the nerve fibers. The facial nerve is not a single wire. It's a bundle of wires which looks like a telephone cable. Yeah, there are many of those inside, and that is about from 7 to 10,000 nerve fibers, which are called axons. They are just long branches of nerve cells, which are called motor neurons. And those motor neurons sit inside the brainstem, inside the nucleus, which is a root of the facial nerve. So when the damage to the nerve fibers happens, it happens usually here in the paramidiotemporal bone. And what happens if the damaging factor, in our case, herpetic infection, is active more than just a few days, or the 2, 3, 4 maximum days, then a rather heavy damage to the facial nerve tissue happens, and we observe so-called degeneration of the facial nerve fibers all the way between the site of damage, which is 99% of the cases here, all the way to the facial muscles. But there are also good news. The root, which is nucleus of the facial nerve, remains intact inside your skull. So if anyone tells you your nerve is dead after Bell's palsy or after Ramsay-Hunt syndrome, don't take it. Your nerve is not dead. The same as when you cut the grass in your garden, the root of the grass blades remains within the ground, and with the time, the grass blades will grow back. It doesn't happen overnight. It doesn't happen over 2 or 3 days. But with the time, the grass will grow back eventually. Of course, not all the grass blades will grow as quickly as others. Some will grow higher, some will grow low. The same goes with the facial nerve fibers, which has been injured by the serious and long-lasting damaging factor. Those will regenerate, which means grow back, rather slowly, because the utmost speed has been established by some scientific research is maximum 1 millimeter per day, counting not from the day of the onset, but counting from from the day when the facial nerve has been released and when the damaging factor has been removed from the scene. That is another reason why I urge you, when there is a facial palsy, please do your utmost to combat the damaging factor, whatever it may have been. In our case of today's recording, it is a herpes virus. By the way, usually the physician or your medical practitioner will establish your facial palsy as Ramsay-Hunt syndrome only if you see rash or vesicles on your ear or in your inner channel. From my experience, it is not always only that. Usually, when the case is heavy, when there is a pain in the face, in the hand, inside the ear, again, my conclusion, it could happen also due to the herpes virus, but it does not show up as rash on your ear. So that is something that we should also consider. And even if your doctor will tell you listen, you have a pain, okay, fine, but you don't have vesicles on your ear, so it's Bell's palsy, not Ramsay-Hunt, so just take your prednisone and go home. Well, if I may suggest, if you have pain, especially if it's a heavy pain, insist on taking antivirals, and you may want to undergo a blood test to establish whether you do or do not have antibodies for the herpes virus. This is something which I would suggest to you. It's, again, my personal opinion that you should do. Quite often, the patient will say to me, listen, at first I was misdiagnosed with Bell's palsy, and now it turns out to be Ramsay-Hunt. On one side, it is correct. On the other hand, it is not really critical. Why? Because Bell's palsy or Ramsay-Hunt is just two names of the same functional disorder, which is unilateral peripheral facial paralysis. Bell's palsy or Ramsay-Hunt only speaks about the cause, which has been established as herpes virus in the case of Ramsay-Hunt, or has not been established, then it's idiopathic Bell's palsy. So, but basically it's exactly the same sort of injury to your facial nerve. Same like broken leg. The person could have fallen and broken a leg, have a break on his leg, fallen, riding a bicycle, or a car has crossed his leg and it was also broken. So the causes could be different, but the result is the same, broken leg. So we have the same story here. Now, what are the prospects for recovery? For the Ramsay-Hunt, when it has been established, especially when we speak about the serious painful sensations, then the prognosis is not very favorable as far as recovery is concerned. Why? Because the pain and inflammation and of course rash of herpes virus means that there is a very serious inflammatory process going on, and that does not go away quickly, which means that you have a fair chance to develop degeneration and then further regeneration of facial nerve, which takes time, and in such cases some residuals and complications are very likely to appear. Those residuals could manifest themselves in facial asymmetry at rest and or in dynamics. It could result in synkinesis. Synkinesis is involuntary movements of your parts of your face which normally do not belong to that particular facial expression. We'll speak about synkinesis in other recordings. Could be dry eyes or tearing eye. Could be loss of taste, temporary, on the one half of your tongue. It could be tinnitus. It could be some ringing in your ear, or it could be some clicking sound when you speak or when you blink your eyes. It could be various complications can take place. But complications after Bell's palsy is the topic of a different recording. We'll speak about it some other time. Now, if you have questions about your particular situation, your particular case, if you want some answers, please don't hesitate to visit our website, register for a video consultation. I will do that for you, or together with you for that matter. You can ask all your questions. I'll try to give you all my answers, if I have all the answers for you, of course. And then you will have a much clearer picture about what is happening in your particular case. Otherwise, please take good care of yourself. Stay healthy. Don't panic. Don't despair. The recovery will come only in the case of Ramsay-Hunt syndrome. It may take considerable amount of time, up to 3.5 months, from 2 weeks up to 3.5 months. You may be forced to wait for the first signs of recovery. And before we close this session, the first signs of recovery is not the facial movements, is the return of facial symmetry at rest. So from doing this, your mouth line will be more horizontal, your eye from being wide open will become closer to normal size, and the life will return to your face, not in the form of movements, but in the form of general appearance. Thank you for listening. Thank you for watching. Stay healthy and all the best.